The goal of this video lecture is to review some common research designs used in clinical psychology and to discuss some of the strengths and limitations of each of these research designs. One of the simplest research designs in clinical psychology is the case study. A case study is a detailed record of a specific person, group, or situation. A famous example of a case study from psychology is the case of Phineas Gage, who you might remember from introductory psychology. Phineas Gage was working on a railroad when a railroad tie went through the front of his skull and through his frontal lobe, leaving him alive but damaging a very specific region of his brain. He was able to talk normally after the accident, and he walked back to a hotel where he received medical care. But after recovering from his physical injuries, he experienced some major changes to his personality and his behavior, becoming more rude and more aggressive. A very famous case study of Phineas Gage's experience and the subsequent changes to his behavior that were observed was published describing this case and the kinds of information that we were able to gather about Phineas Gage. It included information about his history, about what kind of person he had been before the accident, about the accident itself and the medical care that he experienced, and information from various individuals who had interacted with him over the course of time after he experienced the injury. So this case study provided a lot of information about Phineas Gage over a long period of time and very detailed information about this very unusual case. So the case of Phineas Gage illustrates many of the advantages of the case study. So one advantage is that because you are focusing on one specific example, you can provide both breadth and depth of information. So in the case of Phineas Gage, the person who wrote the case study was able to provide a lot of information about Phineas Gage in addition to information about his injury, and also to go into a great deal of depth, so to be able to provide a lot of detail about the specific case in a way that's not possible when you have a lot more individuals or a lot more data to describe. Another advantage of case studies is that people tend to find them very compelling. So a good case study that really clearly illustrates a phenomenon can be very memorable, and people can gain a lot of information by reading that case study. And finally, sometimes we use case studies because they might be the only way to study rare or unusual problems. So in the case of Phineas Gage, there are not many individuals who have experienced such drastic injuries to their brain and lived so that we were then able to observe the kinds of changes in their behavior and their personality that these resulted in. So it would not be possible to apply a different kind of research design to understand that phenomenon. So in cases of rare or unusual problems, a case study might be the most appropriate research design that we can apply to understand a situation. However, case studies also have disadvantages. One is that they are susceptible to risk from bias. So this can refer to bias in terms of what is described in a case study. So what cases do people choose to present and to write about? And also in terms of the information that is presented. So what information is included in a case study, and is it comprehensive? And this might not necessarily be conscious bias, but this might be influenced by the perspective of the researcher who is presenting the case. Also, because case studies are telling us about individuals, they're going to have idiosyncrasies. They're going to be anecdotal. So in the case of a case study, it can be difficult to generalize. It's not always clear what information from a case study could generalize to other individuals or circumstances, and whether there are potential confounding variables in a case study that might lead us to misinterpret some of the things that we're observing in a specific case. So because of this, case studies can have weaker external validity or be less generalizable to other contexts than other types of research designs. Another important research design in clinical psychology is an epidemiological study. So epidemiological studies characterize the distribution of health or illness in a representative sample of a population. So epidemiological studies can give us important information about things like the prevalence of disease or illness. Prevalence refers to the proportion of a population who meets criteria for a given disorder during a set period of time. It can give us information about the incidence of disorder. So incidence refers to new cases of disorder that develop over a specified period of time. And we can also get information about characteristics that are associated with the probability of a disorder. For example, we could look at risk factors, which are characteristics associated with increased risk for a disorder, or protective factors, which are characteristics associated with decreased risk for a disorder. So an important example of an epidemiological study that we're going to look at over the course of the semester is called the National Comorbidity Survey Replication. So this was a study that was conducted between 2001 and 2002 in the United States, and it is the largest major epidemiological study of mental health in the United States and the most recent major epidemiological study of mental health in the United States. So for the National Comorbidity Survey, we'll also call it the NCSR, researchers surveyed almost 10,000 individuals in the United States, and they selected these individuals so that they would be representative of the population of the United States over the age of 18 in terms of their geographic distribution. So they made sure that they got people from all over the United States. They made sure that they were representative in terms of the kind of place that they lived, so whether they lived in a city or a suburb or a rural area, that they were representative in terms of the age distribution and gender distribution and representation of different racial and ethnic groups. And then they collected detailed information about the disorders that these individuals met criteria for to give us a snapshot of the distribution of mental illness throughout the United States, so that we could answer important questions like, what is the prevalence of major depression? And is it more common in women compared to men? And in what age group do we tend to see the onset of various kinds of disorders? So the National Comorbidity Survey illustrates many of the advantages of epidemiological studies. They provide us with very important information. This is important information both from a public health perspective and also as a source of ideas for further research. So for example, based on findings about risk or protective factors, we might generate hypotheses or develop new theories that we could test with other research designs. However, epidemiological studies also have some disadvantages. So one disadvantage is that we're not able to establish causal relationships with epidemiological studies. So because we are not manipulating any variables, even if we identify risk or protective factors, we can't necessarily say that these risk or protective factors are causing the differences in the prevalence of disorder that we might observe. Another limitation is that because these studies tend to be so large, we're typically only able to assess a limited amount of information. So for example, we might get a lot of information about the different diagnoses that people in a study might have, but we might be missing a lot of important information about their lives. So because we are limited in the amount of information we can get in these studies, they may not give us a full picture of the experience of the individuals who are represented in that data. And then a final challenge with epidemiological studies is that the findings from these studies may not be comparable over time. So when we look at the NCSR data, we're going to remember that it was collected between 2001 and 2002. So in 2001 and 2002, diagnostic criteria were guided by the DSM-4. And currently, the DSM-5 has some disorders where the diagnostic criteria have changed. So the next time they replicate the National Comorbidity Survey, it'll be challenging for those disorders to compare the prevalence of those disorders over time, because we won't be totally confident if we see changes that those changes are because a disorder has become more or less common. Or another possibility will be that because of the changes in the diagnostic criteria, that we're not actually measuring the same thing in the same different groups. So that can be a limitation of epidemiological studies when we're trying to look at changes over time. Another important research design in clinical psychology is correlational research, which is sometimes also called observational research, or might also be called naturalistic observation. In correlational research, we're assessing the relationship between variables without directly manipulating them. Often this relationship will be represented by a statistic called a correlation coefficient. So a correlation coefficient is a number between -1 and +1 that tells us the direction and the magnitude of a relationship between two variables. So for example, it'll tell us as one variable goes up, does the other variable go up? That would be a positive correlation. Or as one variable goes up, if the other variable goes down, that would be an example of a negative correlation. And the magnitude of the correlation coefficient tells us how closely related the two variables are. So if the two variables are very closely related and changes in one variable are very strongly predictive of changes in the other variable, then we would see a correlation coefficient that's close to +1 or -1. As the relationship gets weaker, the size of the correlation coefficient will decrease, and a correlation coefficient of 0 tells us that there's no systematic relationship between two variables. So in clinical psychology, we are very often doing correlational research, where we are looking at the relationship between two variables without directly manipulating either of them. So for example, we might be looking at the relationship between beliefs about the world and symptoms of depression. We might be looking at the relationship between how sensitive people are to potential rewards or threats or punishment and symptoms of bipolar disorder, such as mania. We might be looking at the relationship between how many magazines people read and symptoms of eating disorders. All of these are examples of topics that we'll look at over the course of the semester, and this research is based on correlational research, where we're looking at relationships between variables, but we're not manipulating them experimentally. So correlational research is very widely used and has a lot of advantages. One is that it can be used to assess very, very important questions, and often correlational research will be the only research method that may be feasible or that may be ethical to assess a particular kind of research question. So for example, when we discuss trauma-related disorders, most of the research on trauma-related disorders is correlational or observational research. Because if we think about experiments on trauma exposure, it would not be ethical to conduct experiments and deliberately expose people to major traumatic events in order to understand how they respond to them. So correlational research is often more feasible, more cost-effective, more available, or more ethical than using experimental designs to study a topic. However, a major disadvantage of correlational research is that it cannot establish causality. So because the experimenter is not manipulating the variable, there's always the possibility that there are other explanations for that correlation. One possibility is that you might have a directionality problem. So if you observe a relationship between variable A and variable B, you don't know, could variable A be causing variable B, or maybe variable B is causing variable A. Another potential explanation is that you might have a third variable problem. So maybe both variable A and variable B are being caused by a different variable, variable C. So when the experimenter isn't directly manipulating these variables, we can't rule out those alternative explanations. A major problem with correlational research, however, is that when people read and interpret correlational research, they tend to talk about it as though the research is showing causal relationships. So if you've ever read something like a BuzzFeed or a Time magazine article about psychology research, oftentimes correlational research will be presented as showing that some variable is causing or leading to an outcome when the nature of that correlational research design can't actually show that kind of causal relationship. So when we're talking about observational research, we need to be really careful that we don't discuss causal relationships that can't be supported by that kind of research design. Which brings us to our final research design, experimental research. The defining characteristic of an experiment is that the researcher manipulates a variable under controlled conditions in order to observe the effect on another variable. So because of this control and manipulation, experimental research is the only kind of research that can conclusively demonstrate causal relationships. And there are a wide variety of kinds of experimental research that we'll discuss over the course of the semester. So some experimental research is conducted with animals. So we might use animal models to understand underlying processes that could be related to phenomena that we observe in humans. So for example, in Dr. Smith's behavioral pharmacology lab, he conducts experiments manipulating various characteristics of animals' experiences, for example, the amount of physical activity they get, and then observes the effect of that on a behavior. For example, how much of a substance such as cocaine they might choose to ingest when given the opportunity. So because Dr. Smith is experimentally manipulating the amount of exercise that the animals are getting, he can demonstrate causal relationships between exercise and substance use. We might not necessarily want to do this in human populations, so these animal models can give us important information that we might then apply to understanding substance use in humans. Another important type of experimental research are what are called laboratory analog studies. So a laboratory analog study is an experiment where you bring people into a lab and have them engage in some kind of activity or task that is designed to be analogous or similar to a real-world experience so that you can study it under controlled situations. So for example, I recently conducted a laboratory analog study where we were looking at seniors in college and the level of stress that they experienced when they were applying for jobs. We could have studied this with observational research and asked graduating seniors about how stressed they felt about applying for jobs, but instead we wanted to conduct an experiment where we brought them into the lab and we gave them job applications and had them conduct tasks related to applying for jobs, and then we measured their stress levels. So we manipulated various elements of the circumstances so that we could evaluate the effects of those variables on how stressed out the seniors felt while they were applying for jobs. So that's an example of a laboratory analog experimental design. Another important experimental design that we'll talk about this semester is treatment research. So in treatment research, we are evaluating the effects of some kind of treatment. It might be a form of psychotherapy, like cognitive behavioral therapy, or it might be some kind of medication, like an antidepressant medication, and observing the effects of that treatment on an individual's symptom or disorder. So in an experimental design, the researcher is going to manipulate whether a patient in a study receives or doesn't receive a treatment in order to observe the effect of receiving that treatment on their symptoms or disorder or on that outcome. So there are a wide range of types of experimental research, and the advantages of all of these designs are that the experimenter is controlling the important variables. So unlike in observational research, the experimenter is determining who in the study is exposed to the variables and at what level they are being exposed. And because the experimenter is manipulating this under controlled conditions, this is the only research design that can demonstrate causation. There are disadvantages to experimental research. So as we discussed, there are sometimes ethical considerations that prevent us from being able to conduct experimental research. For example, at the end of the semester, we'll be talking about some research investigating the relationship between child maltreatment and symptoms of psychopathy. And this is something that could not be studied experimentally, so it would not be ethical to experimentally manipulate which children were abused in childhood and which children were not. But this is a really important research area, so sometimes we need to use observational research to understand very important topics. So sometimes an experiment is not ethical, or also sometimes it just may not be feasible. It may be very difficult to conduct an experiment. So even though experiments are important and can demonstrate causality, it's also important to keep in mind that we also get valuable information from all of our other research designs. Another potential limitation of experimental research is that because they are conducted under controlled circumstances, their external validity may be more limited. So it may be less generalizable to real-world circumstances. So for example, the data from my study of the college seniors who might have felt stressed out applying for jobs, I might not have gotten a really accurate perception of how stressed out they really felt when applying for jobs on the basis of how stressed out they felt when they came into the lab and completed our tasks. So experimental research tends to have high internal reliability, but lower external validity.